Hey, this is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and the Light Away in Huntsville, Alabama. Today we're going to talk about the COVID-19 pandemic. We've been talking about sheltering in place, social distancing, and mask wearing, and washing your hands and sanitizing. Today we want to spend some time talking about some other things that we're seeing as a result of the pandemic. Let's get started. So we've been talking about COVID-19 in lots of different ways. One of the things that we've been actually talking about is COVID-19, the infection, how you get infected, the vaccine. Should we take the vaccine? Should we not take the vaccine? Also, we've been talking about symptoms, right? Some people are having, coughs and body aches, fevers, chills. What we're finding, though, is the post-COVID, and I guess we're calling it the pandemic fatigue, right? So I've read an article recently, and they were talking about the fact that 23% of physicians have been affected financially, some to the point where they actually have left their practices and are now doing other things. Like one article that I read said there was a physician out in California, and he was actually he had actually left his practice and he was now working in a warehouse. There are physicians who have left their traditional practices and are now becoming coaches, right? So and they're coaching other physicians on how to transition from the traditional practice into the information age. They're online now. They are seeing patients across the country, and I need to change that a little bit. So not necessarily patients, but clients. And so they're not necessarily practicing medicine in the traditional sense, but they are now in the business of conveying information. Okay. And part of that is because, reimbursement from insurers has not kept up with the pandemic. In our practice, for instance, we, for the first 3 or 4 months of COVID-19, I remember March the 16th was when our practice went virtual, and we were virtual for about 4 to 6 weeks. And during that time, the insurers were not reimbursing at the same level as they were if you saw patients in the office. And then there were some patients who didn't want to be seen virtually because they thought that the pandemic was going to be short-lived because of all the media attention that was happening, and what we were being told. They thought that that it would not last long, and so they were kind of waiting it out, if you will. But those initial days, the pandemic really took its toll on our practice. And so I can imagine there are physicians who are out there who also had those problems. And I'm talking about physician because I'm a physician, but remember that the pandemic and the closures that we have, the stay at home, the shelter in place, affected people around the world. Okay, so it wasn't just that it was a segment of the population that was affected, but everyone was affected across the board. And that had played havoc with our economy. And so we find that, there were grocery stores at the time that were doing different things. Or we have a place here in town that's a sandwich shop, right? They sold sandwiches, hoagies and Philly cheesesteak and so forth. And they began selling regular groceries. So across the segment, we've had a lot of people who've done so many different things just to survive. So I want to talk a couple of things. One, I want to spend some time talking about the economic impact that COVID-19 has had. I want to spend some time talking about the social impact that COVID-19 has had. And then finally, I want to spend some time talking about the psychological impact that it's had on our community. Imagine a time when the entire world stopped. That's right. I said the entire world stopped. So, during the first days of this, right? So March, April, May of 2020, there were very few flights. People were not traveling interstate. But imagine and remember that there was this time last year where our country shut down. And if you think about what was going on around the world, right, several countries actually shut down as well. And so financially, you can imagine that had a huge impact. So people who had businesses who were not making income, or their income had dropped significantly, still had to pay the light bill. They still had to pay the rent. They still had to pay employees if they decided that they were going to hunker down and they were going to ride this out together. There were several businesses, several physician offices, several entities that could not survive. And so, people were furloughed, people were let go. Luckily, we were blessed that some of the business loans and business subsidies that came through the federal government, in some cases the states also had their programs, were able to help several businesses, and so they were able to get some of those employees back. I was talking to a colleague of mine who said that in their practice, they made a conscious decision that they were not going to let anyone go. And so they actually had to go into their practice reserves, right, their savings, to pull money out so that they were able to support and keep the practice going. So that's amazing. Now, I've got to say one thing about that, right? Because there was so much animosity that was surrounding COVID-19, the elections, the civil unrest that was going on. And I'm so proud and I'm so excited that even in the midst of all that, there were pockets of people, pockets of communities that pulled together. And that's how we have survived financially through COVID-19. Okay. It wasn't some huge mass, and thank you to the federal government and the states for what you did, but it was the people, right, who helped their neighbors. It was the churches who went out and gave out food. It was the mom and pop who owned a store and allowed people to come in and get food at a low price. It was some of the stores who had special times where they allowed the elderly to come in so that they decreased their chances of contracting COVID-19. So in the midst of all the financial things that went on, it was the communities that pulled together that really kind of helped us get through that, and we're still, even now, not out of it. And there are several business at the end of all of this. When COVID-19 is finally handled, there are going to be thousands of businesses that are no longer going to be in existence, right? They had to close. They couldn't survive. But the ones that survived, a lot of them survived because it was a community effort, and communities got together, and communities decided that we were going to not wait for other people to help us, but we were going to do that ourselves. Okay? So that's financially. So socially, think of taking a child at my son's age, 11, 12, 13, 9, 10, 8, and pulling them and essentially them being isolated from their peers. The interactions that they used to have, right? The development that they used to have was not there. Our young people who are 10th, 11th, 12th grade, right? They spent the last year and a half, if they were not out, if they were virtual, they spent that time when they should have been enjoying some of the best 18 months of their lives, right? Talk to your parents. If you're listening to this and you're a young person, talk to your parents, right? Those 18 months when they were heading out of high school, when they were in the 11th grade, going into 12th grade, and then getting out of high school. Those are some of the best times. Okay, I'll just have to say that. And they didn't have that. People who missed proms, people who missed so many of the functions that we associate with getting out of high school, right? They did not have that. And so we are, we still have not understood what that means for several of our young people. And it's going to be interesting to see what happens as a result of that. For our older folks, right? People my age, people who are older than me, people who were in nursing homes and they couldn't see their families. There are families who lost loved ones who were in the hospital and they did not get to be with them in their last hours. That's something that's on their minds. That's something that's there. That's something that is that they're going to remember. Okay, and we still haven't seen the results of that yet. Right. So COVID-19 is still here. We have relaxed some of that in many cases, but in several instances around the country, you can only have one person in the hospital. You can only have one person in the room, if at all. Right. A mom who's giving birth. Right. A mom who's giving birth. I mean, one of the most joyous times in a family's history. And mom is there by herself. Her mom can't be there because of COVID-19. The husband is there in several cases, but the other people who normally come together to celebrate can't do that because of COVID-19. We have these masks that we have worn, right? Which was a necessity. But you couldn't see people's faces. You couldn't tell their expressions. There's this distance that has developed. Okay. And we're getting used to that. The mask, I was telling someone recently that I left my office and got all my stuff, got it into the car, and I'm driving down the highway and I'm halfway home before I realized, oh, wait a minute, I still got my mask on, right? So it's becoming this kind of common thing that we see. If you told me a year ago that we would be walking around, we would be wearing masks, we would be all the things that has been associated with COVID-19, I would have said you were crazy. Right. But here we are. We're social distancing. We're sheltering in place. We are staying at home, and it is having a social effect on us. We still don't understand what that's going to mean. And then emotionally and psychologically, a lot of us did not realize how much we liked people until we had to stay away from people. Now, I have to give a shout out to our pastor, right? Pastor Carlton Bird, who is the pastor of the Oakwood University Church. If you've not done so yet, you've got to tune in, and you've got to see the program that he and the team, his associate pastors and the media team and all those who are involved have been putting on through COVID. And it is great. It's wonderful because we still get a sense of connection, right? So every time I see, the children's program, and I see one of the kids that I used to see in church, I have a connection. Every time I see one of the pastors get up and do something, every time Pastor Bird says happy birthday to somebody, in our virtual community now, I have a connection. I feel a connection to those people there. But it's nothing like being in the building, right? And you may not have done this at your church, but our church, we have a time where they sing a song and we get up and we walk around, right? And we greet people and we say hello and we hug and we shake hands. And I mean, it's amazing, right, to see the connection that we make with those people in those simple exercises. And that has been missing. And so people don't have that anymore. Right. I've had patients say to me, I don't know what I'm going to do. I miss going to my church. I miss seeing those people. And so COVID-19 has had an impact on that. So those are just a few of the things that are very obvious. And we don't know yet what other things we're going to see that come out of COVID-19. But I want to give you some thoughts, okay? It's not all negative. We have had a tremendous impact with this pandemic. And we have had financial, we've had emotional, we've had social consequences. But take some time to reach out. There are other people that are feeling the same thing. So pick up the phone. Okay. Everybody now is like a Zoom and a Google Meet and a WebEx and a GoToMeeting expert. Okay. So we've had to do things now that we didn't have to do before. So pick up the phone, get on your device and call somebody, maybe somebody you haven't spoken to in a while. And just to say hello, okay? Take the time to reconnect with them. Take this time to do something for yourself. Things that you have wanted to do that you've not had the time to do, guess what? Here you are. You've got time, right? Some of you are still working at home, and you're going to be working at home for some time now. Even though things seem to be getting better with the vaccines that are out, and we're understanding more and more about COVID-19, you still have time. You're still not at work, right? So take time. When on your lunch break, you're at home. Walk around the block. Get your wife, your husband, your children, right? Get your family, your mom, your dad, and go walking, right? Spend some time to develop some new things in the family, some new rituals that you and your family do. Okay. We have been very intentional about having our Friday evening worship with our family. We've been very intentional, even though we're not at church, of sitting down and watching our Bible teachings and watching our church and making sure that our son is watching the children's program. I'm involved with a couple of the children's ministry and teen ministry programs at our church, and we're very intentional of making sure that we continue those. Okay, so get involved. You'll be surprised. Your church may need your help, right? They're looking for people. There are churches that are giving out food, right? So get involved there. Be one of the volunteers. Go out and help doing that. Help do that. There are places that are looking for volunteers. If you're in the allied health, medical field, there are places that are looking for volunteers to help with vaccination. Okay, so you can take some time to do that. If you need help, contact your provider, contact your medical provider. Don't sit and suffer silently, right? Reach out to other people, and definitely reach out to your medical provider. We get through this when we do it together. Regardless of all that has been said and all that's been done, all the animosity, all the fighting, all the really heinous things that we've seen over the last year, We only get through this. We only thrive through this when we do it together. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and The Light Away, educating the public for a better you.